Hi, this is Danielle Varda, CEO of Visible Network Labs. During this unprecedented time of the COVID-19 pandemic, VNL is doing everything we can to use our skills and resources to help. Towards that end, we have modified our partner platform as a COVID-19 patient contact tracing dashboard and analysis tool. Social distancing cannot last forever. We only have weeks to figure out what comes next. Once numbers slow, we need to get back to textbook epidemiology, widespread testing, and contact tracing. Our solution to adapt our partner platform using systems mapping and data science is the ambitious moonshot level effort needed. We use network science to simplify tracking complex relationships among people and places, improving speed and reliability to track contact networks. The existing contact tracing methods are not sufficient. Experts cite that we will need to have a huge team of tens of thousands of people in place to trace the contacts of those who test positive. Our leaders need to ask now, who will do this work? Public health workers, National Guard, laid-off workers. What is the vision and strategy to move us to the next phase? Visible Network Labs has a production-ready solution that has been modified for the COVID-19 contact tracing use case. Our project will implement our existing partner platform to make contact tracing easier, faster, and more effective. The platform can collect infected individuals' contact network data, store it in one platform, and perform real-time contact network analysis and mapping. Partner is an evidence-based tool for early detection, cluster analysis, pathway diffusion, and modeling to rapidly identify contact networks and inform public health decision-making. The method includes 3 steps. First, a patient or provider will enter a contact list using a simple web-based link. To demonstrate, after clicking on the link, a patient can enter their name and get started. After consenting to participate, the patient can simply click here to add a place where they've been or a person with whom they've had connection. Once they've listed all of these people and places, they'll be asked one question about them: what kind of contact they had. Did they have physical contact, sharing drinks or food, or coughing or sneezing? They can choose in which ways they've had connection with those people or places, add any notes, and simply hit submit. Every time that's done, the data get fed into the map, and the map will automatically update to track and record those relationships. We can instantly see how networks are connected and where there is potential for spread. We can filter throughout the system and maps to just be able to see, for example, all infected individuals at one time, or perhaps those that they are connected to that are not yet infected, and the unknown folks who we know are part of the network, but we're not sure because they haven't been tested. Each of these images can be modified based on how we ask the questions. Another useful view is of how they are connected. So here we can see, for example, those that had physical contact with this person or place versus those who may have had no contact, but they were only close to the person. Not only is this helpful in real-time data tracking, but it helps us understand how the virus spreads. We can see these different views and better understand who's been connected through a contact and how those connections formed. We can look at the data in a few different ways, also by, for example, patient and patient contacts. so we can isolate the data according to those different ways of seeing it. If we want to learn more about any one node in the network, we can simply click on it and get information about that node, including some of their network statistics, which help us quickly identify those that are most at risk and vulnerable for connection and contact from an infected individual. Finally, we can go over to the GIS map, which loads in this case, county level data of those who are 65 and older by county. We can see how different levels of contact are being experienced at different parts of the state. We may be able to see contacts within an area and across areas. In this way, we can also look at the network map and different ways in which they have connected, just like we would in the other view. In this way, we can identify who are the most vulnerable at any one time and where those connections lay across the state, so that we can begin to understand how they are connected from one area to another and how spread might be occurring across geographic locations. We know that current methods are expensive, labor-intensive, and do not have the ability to handle the scale and scope required to stop COVID-19. Most include keeping notes on paper and at best in spreadsheets. The data are not linked together beyond the personal level, and it is difficult to aggregate the data into community-wide diagnostics. Contact tracing is like a puzzle, and without a digital system that feeds into one database, making it simple for data to be entered and analyzed, it can spiral quickly. When the partner COVID screener is used in the field, the data set grows and analytics become stronger and more precise. Detection can be quicker and more reliable. We're anxious to get this system out into the field and start contributing to faster detection of COVID spread. To partner with us, simply email us at partner@visiblenetworklabs.com or email us anytime to share your thoughts, ideas, and join the Visible Network Labs community. Thanks, stay safe, stay healthy, and stay home.